Hello, everyone. Good afternoon. Welcome to the Medicine and Nursing Career Panel. My name is Dr. Jennifer Winward. I'm the founder and CEO of Winward Academy, and I'm thrilled to be here today to welcome you all and to, of course, welcome our esteemed panelists. Today, we're going to hear from three consummate professionals in the medicine and nursing fields. We're actually going to go ahead and post a link right now in the chat that will take you to a PDF that has the bios for each of these panelists. So please feel free to read more about each of them as they're going to be kind of answering some of our questions as we go. And then also we're going to come back to all of you at the end and go through any of the Q&A that you post. So please feel free to read more about them if you want to inform some of the questions that you ask, or of course you can listen to what they share and then decide what questions you have. Now, this career panel today is proudly presented by the Carol Kimmelman Athletic and Academic Campus, or CCAC. For those of you who might not be aware, CCAC is a world-class facility breaking ground in early 2021 in Carson. It is going to be the largest academic and athletic campus in the country, serving over 20,000 students in LA and beyond, thanks to incredible partnerships with the US Tennis Association, the Tiger Woods Foundation, Disney, ESPN, AEG, the LA Galaxy soccer team, the Karsh family, and Winward Academy. So lots of organizations working together to bring this great center to Los Angeles. I do want to give a special thank you to Cedars-Sinai Medical Center for working with the CCAC team to organize such an outstanding group of panelists to speak with you today and to inspire your career pathways in healthcare. On behalf of all of us supporting CCAC, we thank our nonprofit and school partners for collaborating with us on this panel and participating with us today. We have a lot of teachers who have joined us who are actually live streaming their classes with this presentation and facilitating questions and discussions with their students, which is exactly what we love. So again, just thank you for participating and thank you for working with us to coordinate this. Now it's time to introduce your esteemed panelists. Again, feel free to go to their bios to read more. Today we'll be joined by Dr. Lindsey Ross, who is a faculty neurosurgeon at Cedars-Sinai Medical Center. Also by Dr. Michelle Williams, who is an executive director at Cedars-Sinai, and Cindy Chavira, who is also an executive director at Cedars-Sinai. So an incredible group of consummate professionals, again, in this field. Also joining us today is a student co-moderator, and Omar and I are going to be working together to ask questions to our panelists. Omar is actually a junior at University of Pennsylvania. He's double majoring in medical anthropology and health and society, and his concentration is in global health. So hello, Omar, I see you've turned on your camera. Thank you again for joining us. And also one thing too about Omar that I'll hopefully be able to have time to ask him about at the end is he is actually a socio-medical researcher who is developing community needs assessments in the West Philly community to inform care that's provided at a health center there. So very interesting. Hopefully we'll get to learn more from Omar. And of course, we'd like to now welcome Dr. Ross to please turn on her camera, and we will get started with those questions. So Dr. Ross, can you hear us?
I can hear you. Thank you for having me.
Absolutely. And I know that Omar has a burning question he wants to ask you. So Omar, go ahead and take it away.
Yeah, thank you so much for coming. My first question is, undergrad at Stanford, med school at UCLA, residency at Cedars-Sinai, and then a White House fellow for the Obama administration, and also a neurosurgeon and spine specialist. I mean, wow, what a truly impressive career. Surgeon and White House fellow seems very, very different. I really want to know, what have you liked and learned in each role?
Sure. So you're completely right, Omar. Being a neurosurgeon on a day-to-day is very different than working as a fellow in the White House. And so my typical day as a neurosurgeon, really kind of wake up around 6 o'clock. A few days a week, we have surgeries that last about 2 hours up to 8 to 10 hours. And then other days of the week, I might see patients in clinic. And then another day a week, I might do research. So right now I'm doing a lot of research on the spine robot and how human factors, all the people that are in the OR, how they help to make the operating room efficient with the robot. And I also do some disparities research for the neurosciences department. So I love to wear a lot of different hats, even as a clinician, but being a White House fellow is completely different. I got to wake up at 8 o'clock, stroll into an office job. There was a lot of meetings and discussions about policies. And one thing I worked on quite a bit for the Obama administration was the Zika epidemic. And so I think it's very interesting to be on both sides where you see how do you create the policies that determine where the doctors, the nurses, the administrators go and how they function in a pandemic, and then actually work on the ground and see how those policies actually play out. And I think it's really important to have people that have taken care of patients speaking to the people in Washington about what really should be done and what the policies should be. So it's important that there are some people that have both of those experiences, but I love to play a lot of different hats. It's hard to put me in a box, and I just really kind of follow my passion and try to do the best that I can for as many folks as I can.
That's wonderful. So I have a follow-up question to that, kind of more about your experiences in your career. So you founded a Doctors for Diversity committee, and you were also on the Health Equity Council. So how do you take those experiences, and how can you kind of share with our audience, like what motivation do they need? What resources do you think teens need to have medicine as a career goal? And kind of what support did you have? What are just things that they should be looking for to be successful?
Yeah, I think first and foremost is to make that goal. What do you want to do? What do you want to be? And then to really just be relentless and never give up about obtaining that goal. And never feeling like just because you don't see somebody that looks like you who is doing what you want to do, or it's too difficult, or it's too financially expensive, or there's no access. Really just set the goal and just be relentless about it. And I think the next step is really finding people that are similar to what you want to do. So finding mentors along the way and continuing to get lots and lots of mentors, not being afraid to ask for help along the way. And, my path has not been straightforward, and it shouldn't be. And I think we learn a lot from our failures, and that's okay. I had to take the MCAT a couple times before I really liked my grade and was able to apply to medical school. But all those things really helped me in the future. So I know, okay, the next time I took an exam, I had better studying skills. I had a schedule set up, and, I killed it the next time I took a standardized test. So, you can't let those failures really kind of define you. You just set your goals and you continually try to work towards them until you get it. So I think that would be kind of, and then talking about like the Doctors for Diversity committee and the health equity is, once you get to those places, those little steps along the way, just to be sure to reach back and help the people along the way that need to work their way to whatever level you have achieved, whether it's graduating from high school and helping the middle schooler, or graduating from college, or graduating from medical school. Each step of the way, you're going to have some other folks that are going to need your advice and need your mentoring. So just remembering that, and that's kind of why I continue to strive to do those other things, even in my busy clinical practice.
Thank you so much for sharing that. I have a follow-up question, and I think you've touched on this a little bit when you talk about mentorship, but I was wondering, where can students who aspire to be doctors look for help along the way? And what advice do you have for them, throughout their journeys?
Sure, and I think I saw somebody in the chat. So I'm a brain and spine surgeon. That's also called a neurosurgeon. And so I operate on the brain and I operate on the spine. So that's what kind of doctor I am. And I think it's important, if you have this vision, say I want to be a doctor, but you don't know too many other doctors, you don't know anyone that looks like you. I think the one place you can go are the national organizations to kind of help get some pipeline programs, scholarships, advice on where to go and where to seek help. And there are lots of organizations whether it's the American Medical Association or the National Medical Association, or even the medical student groups, the Student National Medical Association. They have so many scholarships and so many pipelines and so many people that you could get plugged into to get more information. Another place to start is to go volunteer at your hospital, volunteer at your clinic, really understand what it feels like to be in medicine and take care of patients. And then you'll meet so many folks along the way, and you might be surprised about all the different fields that we have in medicine, not just doctor or nurse, but we have researchers and we have phlebotomists, we have the scrub tech that hands me the instruments. We have, I mean, it just goes on and on and on about the amount of people that we need to keep all of our country healthy. So I would say start there.
Yeah, and I have a follow-up question to that, because it sounds like some people attending are very interested in, neurosurgery. Can you maybe just take us through? I know you mentioned at the beginning, sometimes it's 2 hours, sometimes it's 8 hours. Like, what is it like to operate on a brain?
Yeah, so actually I was on call last night, and I was woken up from my sleep, and a woman fell, and she was on a blood thinner, and she had bleeding in her brain. So that means I need to wake up, figure out what's going on and decide if this patient needs an operation. She did. And so I went down there, and you assess her, you see how she's doing. You'd have to talk to the family about the risks and benefits of doing a craniotomy, which is opening up the skull and removing the blood, and then kind of talk to them through what's going to happen afterwards. And you're all trying to do this very quickly but calmly, so you can assure the patients that their loved one is going to be safe in your hands. And it's a lot of responsibility, because when someone says, yes, I want you to operate on me, I have to be completely focused at that time when I'm in the operation. I cannot be thinking about what I want to eat for dinner later, or how I need to go pick up something from the grocery store. You just have to be focused on that patient and ensuring that you're going to do the best job that you can for them, so they can have the best outcome. So it's a lot of responsibility. It's cognitively, meaning thinking wise, you have to learn a lot to understand neuroanatomy. You have to be emotionally strong when people pass away or don't do well. And then, you have to have physically strong. It's a lot of hours, and it's a lot of time that I commit to taking care of these patients. But I absolutely love it. And I changed this woman's life. Somebody's mom's coming home for Christmas, or whatever holiday they might celebrate in the next couple of weeks. So.
Yeah, that's wonderful. Well, I know there are lots of questions coming in, and I promise Dr. Ross is not going anywhere. We are going to transition to Dr. Williams, so we can learn about her and her role as an executive director as a hospital. But Dr. Ross will be back at the end for the group Q&A with everyone. So please keep the questions coming, and we'll be sure to address them. So Dr. Williams, we can see you. I'm going to turn it over to Omar to ask the first question.
Hi, Dr. Williams. My first question is about your career path. And you have a very unique career in that you've worked hands-on with patients and in administration. And so I was wondering what skills and traits are best for each role, and what would tell me where I would do best?
So nursing is a dynamic field. And the good thing about nursing is that you can work in many different corporations and environments. As a nurse, good skills and traits are, one, compassion, because you're dealing with these people that are used to being vibrant and living their lives and, being in control of what happens to them. But then once they're hospitalized, they become vulnerable, and they express that in different ways. And so you have to be compassionate enough if they're lashing out at you to understand that, it's nothing personal towards you. They feel a sense of loss of self, and what they generally are used to be able to do, they can no longer do. Communication is also key in being a nurse. You have to be able to explain to that nurse in layman's terms and not with a bunch of medical jargon, what's going on, what's happening, and things of that nature. The nurses are advocates for the patients, when, they have questions about something or something, they feel that something needs to be done, they go to the doctors and they go to the social workers and the case managers and hey, we need this, and can you do this? And sometimes those conversations don't go too well. So the art of communication is very important when you're a nurse and you're advocating for your patient. Another skill that's very, very useful in nursing is cultural competence and sensitivity. Not everyone looks like you. Not everyone's culture is the same. And so you want to be sensitive to what their thoughts and their beliefs and their cultures are, and you want to treat them accordingly so that as to show honor and respect for whatever culture that that you're dealing with. Emotional intelligence is another issue for nurses because like Dr. Ross had referred to, things may not always go right. And you have to keep your emotions in check, and you have to know when to express different emotions. In my career, I've, managed a lot of nurses, and, when some of them are upset or, they want, instead of crying, they laugh, and that could be considered as disrespectful by a lot of people, but it's not the point that they're trying to be disrespectful. That's how they handle that particular emotion. And then basic knowledge of the role of a nurse, knowing what nursing entails and seeing if that's something that you really want to do, and not just jump into it because it sounds good, because nursing encompasses and embodies a lot. And then as an administrator, some of the traits and key skills that are good to have is general knowledge of that role as well. Because as an administrator, yes, you still wear your nursing hat, but you also have to have knowledge of budgeting and hospital operations. And you have to like to sit in meetings and deal with the back end of the hospital business. That also takes good communication skills, because as an executive, you're dealing with your COO and your vice presidents and your senior vice presidents, and sometimes even the CEO of the organization. So you have to be able to communicate and articulate what it is you're asking for, or what the needs are, and things of that nature. An executive also builds relationships, because you have to bond and know who you're dealing with, what your audience is, what the need is, and how to go about getting that for your staff or for the organization, and so on and so forth. And I think lastly, what I would think about is being open-minded. You can't just say, no, I don't want to do that, or no, we can't do that, or I don't want to think about that right now. You have to explore possibilities, because you never know what's out there on the horizon and what's meant, to happen that could change, of course, that's really needed.
Yeah, thank you, Dr. Williams, for giving kind of that big overview, right, of how much is involved in being a nurse and developing that compassion and developing those communication skills. And it sounds like something both you and Dr. Ross have shared, right, is that in medicine, not everything always goes as planned, right? So there's a lot that you're also coping with emotionally to take care of yourself at the same time that you're building trust and developing relationships with your patients. So I think that sharing that definitely is just such great insight. I do have a follow-up question for you. So, 2020, as we all know, has been a very, very, very challenging year for healthcare professionals. What have you learned, and what can you see changing for patient care and also for disease management in the future?
I learned that it's okay to have fear of the unknown. When this pandemic hit, no one knew what it was entailed. All we heard is about, or the deaths that were, happening, and how many people were getting sick. And what that did is that created opportunities for other things to happen. So what I've learned through this whole situation in 2020 is disaster and chaos breeds opportunity. You may have processes or something in place that, the system is broken and it needs to be fixed, but no one is ready to deal with that yet. And when disasters like this pandemic hit, it provided those opportunities to say, hey, now's the time to look at this, because we need to be able to deal with the surge that's coming, and how nurses are learning and how patients are being seen and treated and things of that nature. What I feel that's coming for the future of nursing, the future of medicine, because of the pandemic and everything that's happened in 2020, is technology is going to play a pivotal point in medicine. We saw that the patients were able to communicate and visit their doctors via video chat iPads, things of that nature. I don't think that when the pandemic goes away, that that's going to go away. I think that, we learned a new way of communicating with our patients in real time, especially if we can't get to them. So another thing that I think that the public is becoming more and more educated as far as their needs, their health, things of that nature. They're in their research, they go online, they come in and tell you, well, this is what I think is going on with me. Sometimes they're right on the mark, a lot of times they're not. But, and we as healthcare professionals have to learn how to deal with the knowledge that they're bringing into us and course correct without offending or belittling them when they think they got it figured out.
And Omar, did you want to ask Dr. Williams another question?
Yeah. So Dr. Williams, I want to know, how can other people sort of be like you? And what I mean really is, can you really describe the kind of person who makes an excellent nurse or an excellent hospital administrator? What tips do you have for students who are interested in working in hospitals, either with patients or with other administrators?
To me, when I'm hiring nurses, this is one of the questions that I get a lot. What am I looking for in a nurse, and what do I expect nurses to be? I need nurses to be lifelong learners, eager to learn, be adaptable. They have to love helping people. They have to develop their communication skills, because coming into nursing, you're not going to have that at the forefront. That's something that has to be developed, because sometimes you have to go up against the physicians and go, no, this is not what's going on. No, you're not talking to the right patient. You cannot be timid, and because that patient is depending on you. So in saying that is you're that patient's advocate. So those are true key things that help you become an excellent nurse. To become an excellent administrator, it takes for you to be a forward thinker, thinking outside the box, not being traditional, not doing this because this is the way that we always did it. Look for ways to improve upon what you have, or, break everything down to the foundation and build it up again. You have to have understanding, because, depending on where you are in the administration, you have a lot of people depending on you, and they may come to you with problems, ideas, solutions, things. So you have to be understanding. You have to be a good communicator. Once again, I cannot stress communication enough in any role that you go into as a professional, because that's how people understand where you're coming from, and where they're coming from, and you can decide on the needs. To be a good administrator, you have to be a risk taker. You can't always lay in the safe zone. You have to be able to be willing to put your neck out there on the line to do what's best, not only for the organization, but for the staff that looks up to you. You have to be able to solve problems and not kick the can down the road and say, oh, I don't know, ask such and such. You may not have all the answers, and you have to collaborate with other people maybe to come up with the answer. But at least if you're willing to do so, you can do that. And then you have to be a self-motivator. You can't depend on people to tell you your job or tell you what to do, because a lot of times they're looking to you for answers. So I'm always thinking, and I'm always trying to think, what's next? What's my next step? What do I need for the rest of for the staff? What direction is the organization coming in, and things of that nature. So the tips that I have for students that's looking to come into the medical field, whether it's being a physician, a nurse, an administrator, or so forth, is, work your plan your goal and work your plan. A lot of people stumble because this is too hard. Life has gotten in the way. Oh, I can't finish because of this. You have to keep your eye on the prize, and it depends on how bad you really want it. And if you keep going, you'll eventually get to the finish line. Another problem that people usually do is they go, oh, this is a lot of work, it's so much. You're not trying to boil the ocean. Take it in little chunks, piece by piece. You will learn that all of those pieces will add up to a whole.
That's great. I've never heard that saying before. We're not trying to boil the ocean. Let's just take these things one step at a time. I feel like that's great advice for lots of industries, not just for medicine. So Dr. Williams, thank you so much again for joining us. I know we'll have you back here in about 10 minutes. We're going to shift now to Cindy Chavira, who is also an executive director at Cedars-Sinai. Perfect. We can see you, and it looks like we'll be able to hear you. So Omar, why don't you go ahead and ask Cindy the first question?
Yeah, so you're responsible for administrative and academic operations at the Department of Medicine and the Department of Obstetrics and Gynecology at Cedars-Sinai. That sounds like a lot. So did you always know you wanted to pursue this path? What are the skills and training needed to be exceptional in your role?
So I'm going to build upon some of the things that Michelle said. You know, there are often roadblocks along the way, and you just have to figure out what your goal is and how to plan to move around that. So no, I didn't always want to be a hospital administrator. I was actually pre-med at UCLA. You know, life sometimes throws curves at you and you have to change your plan. And that's kind of what happened to me. I you know, had a lot of aspirations to do things differently. And, you know, I reevaluated at that point what my goal was because of the curve that I was thrown. And just in all honesty, you know, I ended up having my daughter. And so, you know, it's hard to go to medical school when you have a daughter. It's not impossible. It's just harder. And I think for me, I've had a lot of great mentors along the way, and really helped me identify what my skills and strengths were. And that led me into hospital administration. So, you know, some of those skills are being adaptable and flexible. You know, as Michelle said, you have to know budgeting, you have to know HR, you have to know marketing, you have to know, you know, business development, strategic planning. You know, it's almost like running your own business when you're a hospital administrator. My end is a little bit different from Michelle's because I'm in service line operations. And so we obviously partner very closely with the executive directors on the inpatient side. But it is almost like running your own business. You do have to be a risk taker. You do have to know many things and for people, because you're almost like all things to your employees that depend on you. So, you know, there's a lot of skill sets, but it's not anything that you can't learn, right? So I think schooling helps. As Michelle said, there's a lot of organizations that help. I think Dr. Ross also said, you know, become members of certain organizations to help you along your way. There are a lot of things that help you. I think for me, one of the biggest pieces that has influenced my career have been my mentors. Mentors are really important, and they're going to help you figure out how to get resources, how to you know, simple things. How do you apply for a scholarship? You know, there are things that they can help guide. How do I handle a situation? You know, I was brand new in my career and was very young to be in management, and depended on my mentors for situations that I thought, you know, I'm not really sure how to handle this. So I think mentors can help you all along the way.
Yeah, thank you for sharing. I think that just the importance of mentorship is everywhere, right? Especially if you're in a new role, and just having people who can provide insight and support and answer questions, which really, in a way, all of you are being mentors right now today for the students on the call. So just want to give a little extra special thank you for your time. So Ms. Chavira, your academic background, you initially studied science at UCLA, and then you kind of shifted to get your MBA, right? So you have a background in science and in business. Did you make that change maybe because of wanting to shift from going to medical school to wanting to be at the top of healthcare administration? Like, where did your path with an MBA kind of come in?
Yeah, so I knew I always wanted to do something in medicine. As I said, I was pre-med, you know, really thinking I was going to go on to medical school. And when that shifted for me, I knew I still wanted to do something in medicine. And very honestly, one of my mentors was a physician that I worked for. He was a pediatric surgeon. And he said to me, you know, you were so great at this administrative side. I was working at UCLA at the time. in the Department of Surgery. And he just said, "You're so great at the administrative side. Why do you want to be a doctor?" Because I hadn't given up my dream of being a doctor yet. But once I reevaluated, I thought, you're right. I do enjoy this and I am pretty good at it. So let's, we sat down and we talked, and, he's like, "What's the next step for you?" And I think that was important, to have a mentor come to you and say, like, why do you want to do this? And to help you reevaluate, is it possible? Of course, anything that you put your mind to is possible, but what is going to make you happy? And at that point, I had a 1-year-old, and, looking at going into the business side, if you will, of medicine, I felt like an MBA would have given me the foundation that Michelle talked about, that I would have needed to get into the business side of healthcare. And so that's why I shifted to the MBA side. And I can tell you that I have a lot of colleagues that have MBAs, but I also have a lot of colleagues that have MPHs and many other degrees and are still in healthcare. I think one of the wonderful things of healthcare is that you can really do many different things. If you have an interest in philanthropy, you can do that in healthcare. If you have an interest in marketing, finance, there's a lot of different avenues, and you can see that from the three of us today. We all have very different jobs at Cedars-Sinai, but have, I think, a common goal of doing something for our community and giving back to the patients in our community. And I think that's what brings us to healthcare. I think that's what draws people to healthcare, is giving back and wanting to help our communities.
Thank you so much for sharing about your journey and, connecting it to today. Today I'm hearing a lot of conversations and discussions about how COVID impacts doctors, nurses, but I don't hear much discussion about how it impacts people like you who help run a hospital effectively and efficiently. And so I was wondering, what have you learned this past year, and what do you see in the future of healthcare administration?
So, we're really the support system. Our doctors and nurses are the ones on the front lines, really working tirelessly in the effort to help, this pandemic. And we're really a support system. We're the groundwork to make things happen. If they need something, how do we react? So I can tell you that I have been at work almost every day during this pandemic. I have not worked from home because in the Department of Medicine, one of the divisions is a pulmonary division. So my pulmonary docs are the ones that deal with COVID. And I also have employee health services, and employee health is the group that tests our employees and, helps navigate some of the issues that come up with respect to the COVID pandemic. And so, I said it in the beginning, we're really a support system. We're here to help those that are doing the work really get through it. Like with my pulmonary division, we worked really hard to add more physicians so that they could cover the ICUs. In employee health, we added, many different ways that you can get tested for COVID. We've added, the newest thing for us here at Cedars-Sinai is the COVID vaccine. So, we've implemented that as quickly as we could to help protect our healthcare workers who are then taking care of patients with COVID. So, we're really the support system for people to make sure they have the things that they need to do their jobs well, and that, we're taking care of them any way we can, putting systems in place, putting contracts in place to get more help for them, whether it's nursing staff or additional physicians. And going forward, I think COVID has taught us a lot. I don't think that in my lifetime I would have thought that we would have gone through a pandemic, right? We've heard of the Spanish flu years ago, and it's taught us a lot. It's taught us to be adaptable. It's taught us to be agile. It's taught us to think differently about how we do things and just really think outside the box. We've had so many creative leaders at Cedars-Sinai just come up with such things that have made a difference in patients' lives. It's really hard when you're dealing with something like this that's unknown. I think Michelle said it earlier also, you learn to be adaptable, you learn to adjust, you learn to do things that are going to continue to give patient satisfaction and to be that patient advocate. I think in the administrator role, we are advocates for our teams, right? So for our staff, for our physicians, and just, help keep the hospital running, because we're constantly shifting and changing depending on what's happening.
Yeah, thank you for sharing those insights. It's been good to kind of hear all of the elements, right? Because again, people tend to think of medicine and think of being a doctor or a nurse, but there are a lot of other people, right, keeping everything running. And so I think it's been really nice to be able to get all of those perspectives today. So I do want to recognize, I know there are a lot of questions that are in the Q&A, and I see that Dr. Ross has been jamming this whole time, kind of answering a lot of your questions live, which is so amazing. I'm going to have to steal her away from those responses that she's doing individually with you. It would be great to welcome both Dr. Ross and Dr. Williams back so we can spend a few more minutes here to do some Q&A and some of these questions that we can pose to each of you to answer. One question that was posed that I think would be great to help our audience is, what are specific opportunities for things that someone should be doing while in high school that can help prepare for going into medicine or nursing or healthcare administration? So any tips specifically for high school students?
So majority of your larger hospitals or facilities have volunteer programs. Cedars have a very robust volunteer program. And so we welcome in thousands of high school students every year so that they can see what it's like just to be in the environment of medicine, to see if it's something that they can either tolerate or deal with. And so my advice to high school students is try to find your local hospitals and see if they have those volunteer programs, because they will put you on the nursing units and they will put you in different places so you can see what that experience is like.
Yes,
Yeah,
oh, sorry, Cindy.
Go ahead.
Oh, I completely agree with Michelle about the volunteering, and there are particular academies and summer sessions that you can apply to attend, and I put some in the chat. Stanford has one. A couple of big academic institutions have them, and oftentimes they're free. So that's one thing you can do in your summertime to try to get some exposure and get ahead of the game. And any type of volunteering. And I think also in high school, just making sure that you start to do some of those science classes, whether they're biology, go ahead and take those AP courses. You don't have to take the test, but go ahead and get your feet wet and take those AP courses and push yourself. And I also wrote in the chat, in high school, I really loved biology, that I decided to take biology course at the local college that was near my high school. I was the only high school student in there, but I just loved biology so much that I just wanted to get more of it than what was offered at the college. So I would really highly recommend just pushing yourself and working in your community, but also doing more science related course material.
Cindy, anything that you wanted to add to that for tips for high schoolers?
So I think they covered it.
Okay.
I was going to say something similar. I think the only other piece would just be seek out mentors. I think mentors are really important and can help guide you along the way.
Great. There have been a lot of questions put in the Q&A to ask about the emotional toll of working in medicine and nursing, and that, Dr. Ross, as you expressed, Dr. Williams, as you expressed, right, these people are trusting you and it doesn't always go well, right? How do you kind of personally cope with that? And there were a lot of questions about that. So it seems like some people anticipating this field are worried about the emotional toll it might take on them. So I'd love to hear your honest thoughts on that.
Well, for nursing, because nurses are the ones at the patient's bedside 12 hours a day. And so it does take an emotional toll because, when you think your patient's okay and they're not, or they die during your shift and you've never experienced death, you don't know how to deal with that. And so, everybody handles death differently and deal with their emotions differently. But I will say that it's okay to be sad, but try not to internalize it and think that maybe it's your fault because, you know, patients come in sick and they come in with all these comorbidities that is going to lead down to death's door. And you can do all you can, and there's nothing you can do to save them. So, but the important thing about being in the medical field is to take care of yourself. You know, make sure that you're dealing with your spirituality, and, you know, that you're doing mental wellness and not mental warfare, you know. And I can say that for some, it gets a little easier, but for some, it will never get easy. But you just have to collect yourself and understand that this is a part of the cycle, and that you have other patients that you still have to take care of.
Yeah, I think Michelle kind of summed it up perfectly. But in my profession, sometimes we do have to talk to patients about death or complications after surgery. And that's just a part of my job. And, you know, you think that you can do it and never have a complication or never have a death, but that's just not going to happen. It's going to happen. So I think learning to speak with families about death and understanding their perceptions of death, and empathizing, like Michelle was saying, like being okay with sharing your emotions, but also being strong for families, and having that spiritual moral compass, I think, is vital when you're dealing with patients who are dying or having complications. You got to understand that there is somebody higher above that's really kind of coordinating all this, and that you, like Michelle said, are just doing everything that you can to guide the families and treat the patients. But really that's all you can really do. And I think if you keep that into perspective, then you're able to go about your day. But I've seen a lot of death, and I'm sure we've all experienced it when you work in the hospital. And there is an element of, okay, if you see it a lot, then it gets a little bit easier to tolerate. But there are still some times, especially when you're dealing with children who die, you know, or people that die quickly, it still gets very emotional, and it's difficult.
Yeah. And I'm glad we talked about this because, I mean, obviously it was a big concern for a lot of the people attending. And thank you both for your, you know, honest answers about how you have personally found ways to cope, but also kind of the reality of what you face in your careers. Hoping to end on a more positive note, Omar, I would love if you, just because, you know, you're currently in college, you have this plan that you ultimately are currently thinking about medical school, that you want to do a post-bac program after you finish at UPenn. Can you maybe just share more with the students attending today about how did you pick your major? How have you found opportunities in the community to pursue, so that, again, you're positioning yourself for maximum success when you kind of embark on this journey?
Yeah, that's a great question. And I want to start this by saying I am the first in my family to go to college. And so going into college, I'm not really sure what careers there are besides, you know, engineering, being a doctor, and law. And so I'm studying something which is medical anthropology, which I didn't know coming into college. And I think, well, I knew a few things. I knew that historically my family and I, my community, have been underrepresented and underserved in medicine. And I knew I wanted to contribute to medicine somehow. And so it was through honest conversations with my professors who, I mean, everybody today talked about mentorship and how important that is. And I can't stress it enough, it really is. And I remember going to one of my professors in college, and I told her what I was, you know, interested in. And she was like, Omar, you need to talk to one of my friends, Fran Barg. And I was like, okay. So she ended up connecting me to someone who told me about this research project that was going on. And one of the local hospitals is doing a community health needs assessment. And most of their approach is, you know, every 3 years they do this assessment. They conduct interviews with people who live in the community to hear about their needs, and it informs care over there. And I said, you know what, I've been studying public health and global health in my classes, and I really want to apply it. And that's how I kind of arrived at becoming a researcher and doing a lot of work on the ground and hearing the needs and informing care, and really trying to make a change to the experiences that my family and my community have always had, which was they were misunderstood. And by informing care at the hospital, I like to think that I'm making a change to that, to the community in West Philadelphia.
That's great. Well, something you shared, Omar, that was stated earlier that it sounds like might be a really good final message for everyone is how important it was to get involved in your local hospital, right? So it sounds like for people who are interested in this field, interested in this career, that just getting exposure to it, kind of seeing what the day-to-day is like, seeing the ups and downs, the challenges, the excitement, is just a really important piece, so that then again, you can kind of find where you see yourself best fitting and best contributing, and then also making an impact. Oh my gosh. Okay. Well, I know that there were a lot of questions posted and unanswered. So I just want to say I'm sorry that we weren't able to get to all of your questions. Again, Dr. Ross, thank you for kind of jamming behind the scenes, typing answers as the other panelists were speaking. And just want to give, again, a huge thank you to Cedars-Sinai and to all of you for participating today and sharing your insights and your honest kind of thoughts about this industry and its future and how things have been impacted from COVID. So again, thank you again for your time. And thank you to all of our students for participating.
Thank you.
Thank you.
Happy holidays.
Bye-bye.
You too. Bye, everyone. Thanks again. Have a great Friday.